Hi, I'm Dr. Stuart Lee, one of the neurosurgeons at Vidant Medical Center, and today is World Stroke Day. Stroke is a really important problem in eastern North Carolina. It's a problem in all of the Deep South, but particularly in eastern North Carolina. The stroke is the fourth most common cause of death in North Carolina, but in our area, it is the third most common cause of death. There are a number of risk factors for stroke, much like the same risk factors for coronary artery disease: hypertension, smoking, diabetes, high cholesterol, lack of activity, and then there's some genetic factors that we can't change. The symptoms of a stroke are often mistaken for other things, and people ignore them until it's too late. And there's a little acronym called BFAST that you can look up online, but I'll go through it very quickly. B is balance or dizziness. The E is for eyes, so if you have sudden trouble with your vision, that's important to notice. The F is for face. Does your face droop? Is your smile asymmetric? Or kind of adding your face to your head, do you have a severe unexplained headache? A is for arms. Do you have weakness or numbness in your arms or legs? S is speech. Do you have trouble speaking? Are you suddenly confused? And the T is for time. Two things about the time. If you have any of those symptoms, call 911. Don't sit around. And secondly, have a family member note when the onset of the symptoms started. That's very important in the treatment of stroke. Here at Vidant Health, we have a number of ways that we can help with patients who have stroke. The first and most important is prevention for those risk factors that I mentioned. The second is all of the Vidant hospitals are certified by the Joint Commission as either acute stroke ready hospitals, primary stroke centers, or Vidant Medical Center is the only comprehensive stroke center in eastern North Carolina. That's important because if you look at where people have strokes in the Deep South, about 55 to 56% of people live over an hour from a stroke center. And the quicker you get treatment, the quicker you are more likely to, or less likely to have deficits from your stroke. Certainly, if you have any of the symptoms that I mentioned, it is critically important that you call 911 or seek medical attention by having a family member get you to an emergency department as quickly as possible. If you have questions about stroke, stroke prevention, stroke treatment that are not emergent, you can visit the Vidant Health website where there's a tremendous amount of information about our stroke program.